Welcome to my podcast. Today I'm going to talk you through ears in general, anything related to the ear station. So basically, after you introduce yourself and double checking the patient's name, date of birth, asking the patient what brought you to the clinic today or how can I help you today. So the patient will tell you, oh, my ears doesn't feel right. So you're going to say, can you tell me more about it? This patient might say, for instance, I'm not able to hear well. I have a feeling like fullness in my ear. I have a pressure inside my ear. I have like a buzzing and hissing sound in my ear. So all of that could point out to Meniere disease, especially if the patient is old. Also, you're going to ask if there is, for instance, a sense of that the things is spinning around you, which is called vertigo, and if there is any deafness at all. And you could ask how long it lasts. Say, for instance, if it lasts 10 to 20 minutes, so yeah, it will click with the Meniere. If it's associated with nausea, vomiting. Also, you will ask if this happened while moving the head from one side to another or in the bed. So that could point to benign positional paroxysmal vertigo, but that usually lasts for a few seconds. Also, you'll ask if there is any associated numbness to one side of the face, for instance, that could point out to acoustic neuroma, and it's associated with the hearing loss as well, and could be associated with blurred vision. You could ask also if there were like upper respiratory tract infection before getting those symptoms or flu-like illness. This could be pointing out to vestibular neuritis. However, you can differentiate between two things called vestibular neuritis and labyrinthitis, whereby there will be deafness in labyrinthitis, but not in the vestibular neuritis, which is associated with the flu-like symptom in, prior to the development of the ear symptom. After exploring all of that, you will examine, of course, the patient. There is two maneuvers that you need to try for instance, rule out or prove or to confirm the diagnosis of benign paroxysmal positional vertigo. And this one should be done with expert in the area, because it could trigger a symptom for the patient. The general advice in those kind of cases, you will ask the patient, you have to keep hydrated. Try to stay in the dark if you feel those symptoms. Avoid anything could trigger the symptoms, and avoid noise. Try to get enough sleep. Keep the eye closed or shut, and fix it if you feel the sense of imbalance. Also, if you feel that you're getting the symptom or they are bending, you need to sit down or lie down, close your eye, and as I say, keep them fixed on a still object. Try to slow down as well if you are walking, for instance, and being careful about your movement. Avoid, of course, caffeine, avoid alcohol, avoid climbing ladders or scaffolding, avoid driving, avoid swimming, any operating machine, because all of that could affect your safety if you have those imbalance symptoms. Also, you'll offer another technique like relaxation, breathing technique, and yoga, which could help as well. And also, you could offer counseling, CBT, if the patient is happy to go for that. And if you, of course, to rule out what was the underlying cause, you will treat accordingly in regard. Because each of those conditions have a specific treatment for it. So that's in short about antigen in relation to ear. I hope that I covered the main point in brief, and not to forget those points if you come across such a condition in PLAB 2 exam. Thank you.